So I'm Sam Durland. I completed residency in a conventional westernized model, and I'm here just to kind of talk to you about the difference between westernized medicine and how they look at hormones, as well as bioidentical hormones. I always want patients to know that I'm not here telling them to do one or the other. I just want them to feel educated so they make a decision for themselves that they're very comfortable with. Now, in westernized medicine, we look at hormone replacement therapy and encourage folks to use the shortest duration possible at the lowest effective dose. And that is based off the Women's Health Initiative study, which was about 17,000 women. They looked at people not on hormones, they looked on people on estrogen and progesterone, and they looked at people just on estrogen. Now, in specific, the only estrogen they put people on was Premarin, and the only estrogen-progesterone combination was Prem-Pro, which is Premarin, and medroxyprogesterone, which is a synthesized progestin. Those are important concepts to understand. Now, what they found in that study is that if people were on estrogen only, they didn't live longer, they didn't live shorter, they just had a better quality of life. If people took estrogen and progesterone, they actually had a little shorter lifespan. In the estrogen-only arm, they did not find a significant increased risk of the risk of breast cancer. So moving to a bioidentical realm, bioidenticals also include testosterone. The American College of OBGYN, of whom I'm board certified, thinks of bioidentical hormones and testosterone supplementation for women as experimental. Bioidentical hormones cannot be patented, so there's no drug company that will actually, I would think, support a huge study, but there are several smaller studies that are out there to reflect upon. Now, when you think about what happens in menopause, it's actually more than just hot flashes. It's mental clarity, it's sleep, it's lean body mass, it's sexual drive, it's vaginal health, it's hair texture changes, it's skin changes. So there's actually more than just hot flashes. But on average, hot flashes will go away for about 6 years after somebody has gone through the menopause, although some women continue to have hot flashes their whole life. So the important basic concepts are there's two different recommendations of hormones. The westernized model, which is shortest duration possible, lowest effective dose. It also supports progesterone or a synthesized progestin only if a woman has a uterus. If a woman does not have a uterus, then they just do estrogen only oftentimes. In a bioidentical realm, they look at balancing all three hormones between testosterone, a bioidentical progesterone, as well as a bioidentical estrogen. Because with the various estrogens, there's 3 different estrogens that our body produces: E1, E2, and E3. And after we've gone through menopause, our body continues to produce E1, but it stops producing E2 and E3 basically. So in the bioidentical realm, they look at replacing the ones that your body doesn't produce anymore. And the bioidentical realm also looks at hormone supplementation lifelong and finds that very acceptable, because that theory believes that bioidentical hormones are anti-inflammatory and are actually very helpful to our body as it ages.